Hi, good morning everyone. Welcome to our live Bites and Stings Q&A. My name's Dr Alex Kew. I'm an infectious diseases consultant working at University College Hospitals, London. And today, this morning, we're going to chat a bit about bites and stings. So I work at the hospital here in central London, and we run a clinic for patients that have unfortunately been bitten or stung by lots of different animals across the world. And we keep getting a lot of questions, a lot of letters sent in about how best to treat and manage these sorts of things. So we thought today, this morning, we'd post some video for you guys and answer some of your questions that are sent in. We've had quite a few questions before this has all started, but if you do have any questions, please do post them in the chat, and I'll do my best to run through them as we get there. So, right, we're going to do this for about an hour or so. If you can't get your questions in, or you have to go make some tea, or the kids are causing problems, post them in and we'll try and post stuff afterwards, and we're going to post a video afterwards. So absolutely get through to that. Right, so let's start going through some of the questions. So first question we've got is hello, welcome. What are the most common types of bites and stings people should be aware of? So obviously I'm talking to you from London in the UK. But obviously this will differ depending on what country you live in from all around the world. The most common things that we see are people affected by their own pets. So obviously that's really common. So if you've got a cat, I mean, I love pets myself, but if you've got a pet cat, a pet dog, we see lots of people kind of interacting with their animals, and unfortunately sometimes that can cause some bites. And obviously insects is a really common cause. So I'm sure everyone listening has been bitten or stung by something when they're going on holiday. The GP Sentinel study done in the UK in about 2015 actually asked that question to everyone, asked how many of you have ever in your entire life been bitten or stung by something. And the response was around 95% of people saying they had been bitten or stung by something. And every time I do talk about this sort of stuff a lot, actually I never see anyone who said, I've never been bitten or stung by something. So really, really common. And most commonly, it's self-resolving bites from insects. So think of your flies, think of your mosquitoes, that sort of thing. Obviously, people who've got kids, they'll know about the dreaded nits, lice from their kids at school. So really, really common, and mostly insects is the answer to that question. Right, next question. How do you cure jellyfish stings? Really interesting question, because this is, it's actually increasing in the UK. So for those of you who don't know the UK very well, it's quite a cold country. I'm saying this because it's actually freezing this morning. It's quite a cold country, and we do have jellyfish species native to the coastal waters, but I'm sure people from Southeast Asia, Africa, South America are screaming at the camera right now because they're saying, oh, we've got loads of jellyfish down there, but it's actually getting more common in the UK. Now, how do you cure the jellyfish stings? And once it's happened, all right? Now, most people, the vast majority of people, whilst the sting itself will be annoying, most people get stung on their limbs. So when you're swimming around, you touch things with your hands, you kick with your legs. So most people will get stung on a limb. Most people will either feel nothing or feel some irritation, burning pain, and they'll develop a small rash if they develop anything. And for most people, a bit like a sunburn, this will resolve by itself. So how do you cure jellyfish stings? For most people, your body cures it by itself. Now, for the few unfortunate people, some people develop mild or medium reactions where they develop kind of a skin-type burning sensation. And that can often be helped or healed using over-the-counter topical creams, lotions, aloe vera lotion. Some people use calamine lotion. Some people use topical steroid creams that you can often get from pharmacies. Can be really useful, especially if it's a small lesion. Now, I think we have a question in here. I've just seen one about myths and mythbusters, and obviously everyone has heard about the peeing on the jellyfish sting. Everyone's heard about this. Everyone's seen this in movies and TVs and everything else. What I'd say is, please don't pee on your jellyfish stings, because you have to pee on someone who's got a rash. I mean, you're on a beach, you're in the water, you're on a boat or whatever. And number two, would it make a difference to it? And it might actually make it worse in some instances. So without going into the long drawn out components of different venoms and poisons, actually, if it's a different type of venom to the contents of the urine, you might actually make the sting worse, not better. So the current advice, and advice all over the place, is please don't pee on your jellyfish stings. So that's the first thing to say. Lots of now first aid kits. So I worked on a dive boat as a rescue diver many years ago now, and we used to have lidocaine sprays or lignocaine sprays. So really, really useful for inactivating the nematocysts, the cells that discharge venom from jellyfish. The other thing to do, I really want to advise people, is I've seen lots of patients coming into my clinic who've been stung on their hands after being stung on somewhere like their legs because they tried to wipe the sting off with their hands, and obviously they get stung on their hands. So please, 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 if you notice you've been stung somewhere and there's any sort of tentacles left behind, please try and wash them off with seawater, all right? Seawater, really important, because if it's fresh water, that can also activate some of the nematocysts. And finally, hot or warm water, not scalding, please don't burn yourselves with boiling hot water, but hot water can also help inactivate some of the nematocysts and can relieve some of the pain. So I'd say hot seawater, wash anything off that's there so you don't get stung anymore. And if it becomes nasty, then some topical creams like topical steroids can be really, really useful. Finally, some people can become very sick and you can get serious jellyfish stings around the world. There are lots of places, mainly in warmer countries, where the stings can be quite severe. It's worth, if you're going to one of these places or you live in one of these places, it's worth checking with your local healthcare literature and online. Lots of places like Australia, Southern Africa, Southeast Asia have very, very good healthcare advice sites about the type of stings. Some of these can be very serious, and obviously if you're getting a serious reaction, so you're thinking of collapsing, thinking of feeling dizzy, vomiting, your face might swell up, lips swell up, if your throat swells up, your breathing becomes a problem, all these sorts of very significant, it will feel like something's happening, then obviously you need to call your emergency services or see a healthcare professional immediately, all right? So really, really important if you do have a really significant sting and you're unwell that you need to see your local healthcare professionals as soon as possible, all right? So I hope that answered your question. People always love about the most dangerous stuff. People always ask about the dangerous stings and bites. The next question is, what is the most dangerous or venomous bite or sting common in the UK? Interesting question, because my answer is probably not one that you were thinking of when you asked the question. If you were to count dangerous, and by dangerous I think the one that probably kills the most people in the UK, the answer is going to be a bee. Now, obviously, if you grew up when I grew up, I'm showing my age now, I watched films like Arachnophobia, I watched Jaws, I watched Birds, all those sorts of films. So obviously spiders are terrifying, and spiders obviously are going to kill everyone, run around, bite lots of people and kill lots of people. Actually, in places like the UK and throughout Europe and Africa, North America, all these sorts of places, lots of people unfortunately develop serious effects towards things like bee stings or wasp stings, and that's because they have an allergic reaction to them. And especially in the UK, the most significant injuries come from bee or wasp stings. So if the question is what's the most dangerous animal, and I love bees and wasps, so I think they're absolutely fantastic. They do lots of amazing things, they do lots of pollinating, they're wonderful creatures, but actually technically, according to the numbers, lots of people comparatively will have a lot more allergic reactions to something like a bee or a wasp sting versus being bitten by a very nasty venomous spider, for example. The most venomous or the most interesting, I'd like to call interesting creatures, I think all of these creatures are fascinating animals. We do have a few snake species in the UK, so some people who live on the southern coast of the UK will know about adders. Often they're only around in the summertime, so they obviously have venom. I mentioned a few jellyfish species, so Portuguese man-of-war is the one that most people will know about. That can be in coastal waters, so those are some of the venomous species that we see in the UK. But obviously if you're watching from, as I say, Southeast Asia or Australasia, Indian subcontinent, you'll know about far more venomous species than we will here. in Western Europe. Right, what's the best way to prevent bites and stings while outdoors? It's tricky, is the answer. Obviously, I just said that most people in their life have been bitten by or stung by something. The vast majority, I would say from my talks, 100%. It kind of depends what you're trying to avoid being bitten by. So it's going to sound really stupid, but obviously, if you are trying to avoid being bitten by something like I don't know, and it's going to sound stupid, like a cow or a horse or a dog or whatever, then avoiding going within the animal's comfort range will prevent you from being bitten. Now, obviously, if you're trying to avoid being bitten by things like mosquitoes, well, that's much, much harder because often these animals have evolved to bite us when we're not aware of our surroundings. So, for example, when we're asleep. So obviously we have, as humans, invented things like bed nets. We've invented repellents that you can use on your skin. If you go into your local Boots or your local supermarket, if you don't know what Boots is a UK pharmacy type supermarket store, they'll have lots of different chemicals that are used, some of which have got lots of evidence, which I'm sure we'll talk about in a little bit, and some of which have smaller evidence. You can use things like bed nets when you're asleep to stop mosquitoes from biting you. So it really depends what you're trying to avoid. When you're outdoors, often the advice is to wear clothing that covers the skin. Because obviously, if something's trying to bite you, let's say flies, midges, those sorts of things, if your skin is covered, let's say, so my arms are covered at the moment, if you've got long-sleeved tops or you're wearing long trousers, socks that are above your ankles and your knees, then obviously that's going to prevent the animal from being able to get to your skin to bite you in the first place. So the easiest thing is just have clothing that covers all your sort of exposed skin. The second thing is about repellents, and it's probably a good time to talk about repellents now. So you'll see loads of adverts on your streaming devices or your TVs or if you go on the internet about this super duper extra strong, kills every insect, repels everything, super duper sprays. Really, there's mainly 4 products that work for insect repellent in general. Deet is the one that most people know about, and it's the one that has the most evidence just because it's been around for the longest time. Has had lots of researchers look into it to see if it works and prevents insect bites. It's not going to do very well for preventing you from being bitten by your pet dog or something like that, but it's pretty good for insects. Deet you can find in local pharmaceuticals to wherever you live, and you can apply it to your skin. Lots of people don't like it because it can cause in some people, some nasty skin reactions. And it also has the wonderful ability of doing melting certain plastics, which always looks horrifying when you put something on and your backpack starts to melt. But actually, if you really wanted to stop yourself from being bitten by something like a mosquito, which is really important if you're in areas where mosquitoes can transmit diseases like malaria, then Deet is the one to go for, all right? The second one that's been invented is something called picaridin. It's from the pepper plant, closely related to pepper. It's slightly nicer on the skin for some people. Again, you can get it in your local pharmaceutical companies, and it's applied to the skin. The third one is the amazingly named IR3535, which, other than having the worst name ever, is a really useful one for people that have reactions to either Deet or the picaridin. And can sometimes help for, as I said, things like mosquitoes. Finally, the one that's really becoming really popular is oil of lemon and eucalyptus, or PMD. You'll see lots of these kind of lemon-scented ones. And whilst they smell really nice, especially compared to things like Deet, which smells very chemically, the evidence isn't quite as strong as the other one. So if I was traveling to somewhere where I really didn't want to get bitten by something that might give me or transmit a nasty disease, I would personally try and use Deet. But if you really can't use the others, then PMD or oil of lemon eucalyptus looks like it has some repellents. Whilst we're on the subject, we should probably talk about the myths when it comes to repellents. So a question I get asked a lot in my clinic is, are there any herbal remedies or any drinks? I've been told that drinking alcohol will stop you getting bitten. Unfortunately, for those of you that like your cocktails and your wine and your beer and spirits, there are actually some studies showing that the consumption of alcohol might actually make you more attractive to certain biting species like flies and mosquitoes. So I'm afraid if you're out drinking with your friends, you might actually be more attractive to the mosquitoes and the flies. So alcohol, I'm afraid, does not stop you being bitten, all right? Right, let's go to the next question. Just waiting a second whilst we get some of these questions to load. Whilst we're waiting for some of the questions to load up, people often ask me a lot about food and plant products that help repellency. What I'd say is, and I just mentioned picaridin was related to the pepper plant, there are almost certainly lots of plants and chemicals that people use in their own countries, their own regions, that almost certainly have some repellent properties. And so if you in your community have noticed that a certain plant that people have used for generations seems to ward off insects, then that's great. The problem as a healthcare professional is we can't advise products unless they've been tested and we know the evidence for them. And so whilst I've only mentioned 4 things, I'm sure there are lots of different remedies that are useful. I just can't recommend them because we don't have the evidence in papers or trials, basically. Right. So let's scroll right down so I haven't missed any. And if I have missed some of the questions, please do post again and we'll try and get to them. Loads of questions, guys. Thank you very much for posting them all. Right. So here we go. So here's a question. I'm a huge mosquito magnet. I know how you feel. I'm also one of those magnets, so solidarity to you. And many anti-bite sprays don't seem to prevent me from getting bitten in areas with high mosquito activity. What's the recommended level of strength of Deet in order for it to be effective? Also, how often should you reapply it? Thank you very much for that question. As I said, I'm a huge mosquito magnet. So I'll give you the scientific answer and the non-scientific answer afterwards. So scientific answer is it's down to the individual. So mosquitoes are attracted by a number of things to people, including heat and chemical receptors that they have on their antennae. And the chemicals that they're attracted by are the chemicals in our sweat. And we all as individuals produce different concentrations of these chemicals in our sweat. So if you're a mosquito magnet, the good news is that you're a mosquito magnet to certain types of mosquitoes, but you'll be less of a magnet to other types of mosquitoes. So unfortunately, me being in the job that I'm in, I've tested myself by having a cage with mosquitoes, seeing which ones bite me. And it turns out that luckily or unluckily for me, the Anopheles mosquito, which is the vector for malaria, really likes biting me, which is good for me, right? Luckily for me, the Aedes mosquito, which is a vector for things like dengue, doesn't like biting me so much. So there's the pro, is that there'll be some mosquitoes that really like biting you and others that really aren't attracted to you. And that's because those species are looking for different concentrations of the chemical that will be in your sweat. So if you or I, 2 mosquito magnets, are in the same room, depending on what mosquito I put in that room, depends on which one of us it'd go for. So obviously, the non-scientific answer is, if you're in the same bedroom with a family member who's really attracted by mosquitoes, that'd be a really good repellent for you, although the family member might be a bit annoyed that they're just getting bitten instead of you. In terms of repellents, this also is very individual. So some people find that when they use, like the question here, some use some sprays and it does absolutely nothing, but a friend or family member uses it and it seems to get rid of all the mosquitoes or flies or whatever. Deet is the one with the most evidence, as I mentioned, so I definitely start with Deet. There's lots of different strengths of Deet being advertised. In the literature, 50%, so 50% is the one that has the most evidence. And it's a bit counterintuitive in the fact that the percentage to me always sounds like that's the strength of it, that's how strong, that's how high the concentration is. But actually for lots of these repellents, the percentage corresponds with how long it lasts for rather than how strong it is. Now, lots of studies done by the American military looking at Deet showed that actually any concentrations above 50% last no longer than 50%, but they were associated with a high number of side effects like skin reactions. So if you see 50%, that's the one to go for. Obviously, if it gives you a reaction or it really isn't working against the mosquitoes you're with, then try one of the other ones. So picaridin would be next. IR35 would be third, and then the lemon eucalyptus would be fourth, for me personally. But that might work differently for you, all right? Be slightly careful about the, as I said, the super duper 80-90% Deets stuff that's being sold. It has no benefit over the 50% stuff. So 50% to start with. How often should you reapply it? I'm sure you guys all are aware the sunscreen industry have done lots of work on this. How often do you reapply your sunscreen? Answer, pretty much never. None of us ever reapply our sunscreen. That's why we all get sunburnt when we go into hot countries with the sun shining. So we are actually really bad, myself included, in reapplying any sort of protective creams. And so my answer to that would be try and reapply it in the first place, because most people never reapply it. Obviously, you'll follow the manufacturer's instructions if you can. Some bottles will say after every couple of hours. I would advise you, depends what you're doing. So obviously, if you're just lying flat on a hot beach somewhere, the sun's shining, you're not doing very much, you're not sweating very much, you're not going swimming, then you may not need to reapply it for a couple of hours. If you're trekking through a jungle, hot, steamy jungle forest, or you're swimming in a lovely river or in the sea, obviously that's going to wash off some of this repellent. And so obviously you're going to need to reapply it at that point, all right? So it also depends on what you're doing. But what I'd say is just try and reapply, because most of us fail at that. Right, is it common to get spider bites in the UK? I'd say no. Now, spiders get a really bad rep, I think, in the world in general, but in the UK. I don't think it's very common to get spider bites anywhere, and that's because the vast majority of species of spiders don't want anything to do with humans, really. Most of them are quite timid. And so spiders don't feed on people as much as Chagrin from Hollywood would want you. As I said, if you watch Arachnophobia, then you'll think, oh, obviously they're trying to come and jump on everyone. But spiders don't feed on people. So really, they don't really want to interact with us at all. The times that you often get bitten by a spider is because you've stepped on it, or it's been in a shoe, or you've put your hand on it by accident, etc., etc. And obviously it's just reacted to it at that point. So I wouldn't say spider bites are that common. I mentioned things like bites from your pet, so your pet dog, cat, or bees and wasps. Things are far more common than spider bites, but spider bites get a really bad rep from causing problems. So spiders, I want to big up the spiders. I don't think the spiders are the main worry for us as people, but they do have some amazing movies and TV series based on them. So, right. Next question is, what immediate steps should be taken if someone is bitten or stung? This kind of depends on what you were bitten or stung by, and also you as an individual. So I just mentioned that actually bees and wasps could be considered the most dangerous because some people have allergic reactions to bee or wasp venom. And that obviously can be very severe. If you have a severe allergic reaction after being stung by a bee, that's very significant. And so for someone who has severe allergies, who gets a severe allergic reaction after being stung by something like, as I said, like a bee or a wasp, your lips start swelling up. Those of you that get these allergic reactions, you're allergic to nuts or what have you, will know about this. But your lips swell, your tongue swells, your face, your skin might swell up, your breathing might go. Obviously, if that happens to you, then the immediate step is to what in the UK call 999. Obviously, if you're in another country, then your emergency services number, please call that immediately. Or if you've had this before and you've been given something like an EpiPen, so some people have been given a pen that you use to inject often things like adrenaline into you to help with allergic reactions, then use that at that moment if you know the feeling of what a severe allergic reaction is. But please do get in contact with your emergency services immediately, because that's quite dangerous. Now, if for you that you aren't allergic to these sorts of bites or stings and you've been bitten, for most of you, actually there's not much you need to do. Some people find things like ice packs really helpful, or ice around the bite. Some people find over-the-counter painkillers like paracetamol, ibuprofen really useful for some of the pain. And finally, I mentioned topical steroids that you can buy from your local pharmacy. They can find that's quite useful. Most of you, if you have a reaction, will have, we call it nuisance symptoms, so small amounts of pain, small amounts of swelling on the skin where the bite was. So kind of over-the-counter remedies are usually useful. Some people can get infection after being bitten. So obviously our skin is amazing at stopping various bacteria from getting into us. And obviously if you've been bitten by something, then the bacteria can get in. So if you notice that your skin is developing an infection, you might need antibiotics for that. And obviously it's worth seeking out your local family doctor or pharmacies to see whether you can get some antibiotics if you get one of those. So hopefully it answered a few different, it really depends on what or how you react to bites and stings, depending on what you need to do. Now, obviously, if you live in a country with very highly venomous creatures, very venomous snakes, for example, then the immediate steps will depend on what has bitten you. And if you think you've been bitten by something highly venomous in one of these countries, please do seek your emergency services or your healthcare providers as soon as you can, all right? What are the best over-the-counter treatments for bites and stings? We sort of mentioned that already. If you've got lots of pain in the skin, then obviously over-the-counter painkillers, paracetamol, ibuprofen is very good. Antihistamines are usually really good if it's itchy, so lots of people complain of really severe itch after being bitten by mosquitoes, sandflies, just flies in general, so antihistamines are really good for that. And then things like topical steroids can often be really useful, and you can get those from your local pharmacies, so are really good for those kind of simple symptoms. And as I said, obviously if you're getting systemic symptoms, then you need to try and see one of us, a healthcare professional, as soon as you can. Right, next question is, what are the risks associated with tick bites? And how can you safely remove a tick? Can you go blind from tick bites? So I'll answer each one of those in turn. What are the risks associated with tick bites? So again, this sort of depends where you live in the world. So ticks, much like mosquitoes, are vectors of certain conditions, certain diseases. So the UK, the one that most people know about is Lyme, or Lyme disease. Rickettsial infections can be spread by ticks in other certain areas of the world. And so it sort of depends where you're bitten by a tick. Now, if you live in a country where the ticks are not vectors of these sorts of diseases, then there is no risk from that. But obviously, if you live in places like southern UK, mainly Scotland, if you live in eastern seaboard of America where you know about Lyme, rickettsial diseases, certain places in Southeast Asia, for example, then there are some diseases that you can catch from being bitten by a tick. So if you have been bitten and you live in one of those, or you've travelled to one of those countries, then just be aware if you start developing any symptoms, and again, worth speaking to one of the local healthcare professionals if you do develop symptoms after that, and mention to them that you've been bitten by a tick, because we can often investigate for diseases that have been spread that way. How can you safely remove a tick? Probably quite hard for me to describe. There's some wonderful advice leaflets. Again, if you're in the UK, gov.uk website and the NHS website shows a really, really good picture about how to remove a tick. But other countries also have this. So I noticed Australia have got really good leaflets. North America, CDC have got some really good leaflets showing you exactly how to remove a tick. There are tick removal tools. So if you're one of those people that hikes a lot through long grasses, which is the kind of areas that ticks mainly live in, you might have seen some of these tools. They were first developed by the vets to kind of get them off your pets. They look like little mini tweezers, and essentially you use these tools to remove them. But if you don't have any of them, try and look at some of those pictures of tick removal. What you want to try and do is when you're removing the tick, you don't want to break it. You don't want to leave any bits of the tick behind in your skin, because that can cause problems down the line. So what you want to try and do is get it with, if all you have is tweezers, don't press too hard, but try and get it right at the point that it's in the skin, and try and pull directly up slowly without breaking any of it. And hopefully you should be able to remove it without being left any parts behind. But obviously if you're worried that you've left something behind, do get, as I said, your local family doctor or one of the healthcare professionals to have a look, see if anything's left behind. Can you go blind from tick bites? Not from the actual tick bite, no. Tick bites themselves, much like any bites, like a fly bite, mosquito bite, is just breaking the skin. So most of the time nothing happens and your body will heal itself. Sometimes you might be left with a bite. Sometimes you might be left with some swelling or some itchiness of the skin. But for most people, that's all that happens. Obviously, if the tick has transmitted an infection to you, then depending on the infection that's been spread, depends on your symptoms. And there's lots of different infections all around the world that can be spread by things like mosquitoes and ticks. So obviously if you're developing symptoms, it's worth seeing a healthcare professional and mentioning that you noticed you had a tick or multiple tick bites, and so they can investigate for those sorts of things. So the tick, no, but there are some infections that you can get from tick bites all over the world that can give you very nasty symptoms. So, what is the current incidence of Lyme disease in the UK, and how can the general public best try to avoid acquiring it? Now, obviously, lots of people in the UK have or might have heard from the news and TV programmes about very unlucky people that have contracted Lyme from tick bites. I think best to try and avoid acquiring it is a bit like what we talked about, trying to avoid being bitten in the first place. So ticks themselves tend to latch on to an animal, say deer or humans, as we're walking through habitats that they live in. So you're often thinking of long vegetation, long grasses, and they latch on to people and they'll bite the skin at that point, all right? Now, obviously, if you're preventing the animal from getting to your skin with, as I said, like I'm wearing at the moment, long sleeves, long trousers, socks over your trousers, then it makes it very, very difficult for the tick to get to your skin in the first place. And so the best way to prevent it would be to not go to those areas where they are, but obviously that's easier said than done for lots of people. Second thing is to wear the right clothing. So if you've got clothing blocking your skin from the tick, then it can't get to your skin. For those people that have done this, then when you get home, really worth checking your clothing. If you've been walking through lots of long grasses, when you get home, just make sure that your clothing hasn't got any ticks on it, so that when you take off your clothing, it can't get to your skin. And then having a shower and having a good look over your skin to see if you've noticed anything. So the best way to prevent it is to prevent the bite in the first place. Obviously, if you have been bitten, then it depends where you've been bitten. So there are some hotspot areas in certain countries. I'll speak for the UK. So ticks are normally in larger concentrations where their food is, which makes sense. Obviously, they need to eat, they want to survive, and so you often find them around areas where there are the hosts that they like to feed on, such as deer. What is one example? Scotland obviously has lots of herds of deer, but places like the south coast of the New Forest in the UK, the western or southwestern coast of the UK, where these kind of deer populations, wild animal populations will be where the highest concentration of ticks are. And so that's most likely where you might catch one of these infections. Now, obviously, just because you've been bitten by a tick, even if it has an infection within it, doesn't mean you're going to contract the disease. The gov.uk website has got some fantastic advice about what to do if you've been bitten by a tick and what symptoms, if you develop any, if you notice, and what to do. And lots of the advice now is that people know if you've been bitten by a tick about the bullseye rash. And if you don't know what I'm talking about, if you Google the bullseye rash, when you see a healthcare professional, we often give treatment for Lyme based on that rash to prevent people developing symptoms for that afterwards. So I hope that answered your question. Main tick populations are around areas where they're feeding on their hosts. So as I said, deer, south coast, southwest coast, bits of Scotland. And so trying to wear long clothing. Repellents you can put on your clothing, some of them, and looking for ticks after you've been walking through these areas to make sure that if you have any, you can remove them as fast as possible. What are the long-term effects of certain bites and stings, and how can they be managed? Really difficult, and something that I'm trying to get better at and trying to do a lot of research in my clinic with people. I see lots of people coming in, sometimes months after they've been bitten or stung by something. People can get all sorts of long-term side effects. So we've noticed some people have had some tingling nerve sensations, some nerve problems after being stung by jellyfish abroad. We noticed some people have contracted illnesses from their bites, with some of the diseases we're talking about. We've noticed some people have developed sensitivities of their skin, so they had no sorts of allergies before, but after being bitten by sandflies, they now have become sensitized to things with harsh chemicals in them, like washing up powders, washing liquids, that sort of thing. So all sorts of different long-term effects can happen, and it sort of depends what you've been bitten or stung by. How can they be managed? Depends on what's happened. So for the people that have now developed sensitized skin, often avoidance of some of the harsh chemicals has really helped them. But things like antihistamines like Piriton have also really helped when they do develop allergies to things they weren't allergic to before. So in answer to your question, we're looking into lots of these long-term effects and how best we can manage them. Can you die from jellyfish stings? Yes is the simple answer. Most people don't. Most people who are stung by jellyfish do not die from it, but some people have. You can get some very serious envenomations from jellyfish, especially in certain areas of the world. So Pacific box jellyfish was one of the dangerous ones, and obviously clues in the name, Pacific. So obviously, if you're swimming in these areas where they're known and you're stung and you develop symptoms after a sting, then obviously seeing a healthcare professional as soon as possible is really important. But even with these jellyfish, lots of people stung by those jellyfish do not die. All right. So yes, you can, but most people won't. What are the best ways to soothe itching and swelling from bites and stings? I've heard that milk aloe vera gel works. Again, this is really individual. So me personally, I found aloe vera gel, and I'm not paid by this company at all, but I'm sure some of you been abroad have seen Banana Boat do this very luminous green gel stuff. It looks gloopy, like jelly. For me personally, if I've been bitten by something that's really itchy, really painful, that seemed to work really well for me. But I know some of my friends that have used it, hasn't worked so well for them. So really individual. Calamine lotion is another one that can sometimes work. Simple creams often work for lots of people. So E45 creams like this that you can get from local pharmacies can often work. If none of these are working for you and it's driving you mad and you're getting real pain from the bite, it's really itchy, you can get low concentration topical steroids from pharmacies. And often a bit of that can work really nicely if you're just being bothered loads by your bites and stings. Now, obviously, if the swelling, redness, pain is increasing and moving across your skin, or you're starting to feel unwell, it might not be the sting or bite anymore. It might be that you've got some bacteria in the bite and you've now got a skin infection and you need antibiotics. So if it's a nuisance and it's just a bit itchy and the bite itself is quite painful, then, as I said, aloe vera, topical steroids might help. But if the redness is spreading, it's becoming really painful, really hot, and you're starting to feel unwell, might be an infection there. So please do go and see a doctor, all right, to make sure that you don't need antibiotics. Do you get many snake bites in the UK? No, is the answer to that. They do happen. We do have snakes in the UK. So people do get bitten every year by snakes, but it's not a common occurrence at all. Snakes, much like spiders, are quite timid creatures. They don't feed on people, so they're not actively looking for us. So again, it's when people step on them or grab them or are in close proximity to them by accident. And in the UK especially, that's not a common occurrence. So it's not common. It does happen though. And we do have professionals throughout the UK that are experienced in treating snake bites from all over the world. And so if it does happen, hospitals can contact us to get the best advice about what to do when it happens. Hello, Dr. Alex, hello. Very good morning. Well, is it still morning? No, it's afternoon. Good afternoon. Is it correct that some people are more prone to being bitten by mosquitoes, and why is this? I get bitten loads. They always still feel hot, very itchy. Am I allergic to mosquito bites or just unlucky? What's the best way to prevent it? Best way to treat it? Currently use a clicker and Urax anti-itch cream. Any other tips? Great question. We talked a little bit about this at the start. Is it correct some people are more prone to being bitten? Yes, absolutely. I'm one of them. So if you ever get a chance, if I ever go on holiday or meet any of you in the real world behind the camera, you'll notice that I'm the one with all the mosquitoes flying around me. So yeah, I'm more prone to being bitten by mosquitoes, and that's because the chemical composition in my sweat is attractive to certain species of mosquitoes. And the same will be for you. As I said, the good news is some species of mosquitoes won't like that composition, so won't bite me at all. The problem being for me, after testing it, it's the Anopheles that likes me, and Anopheles spreads malaria, so not so good for me. People more being prone. I get bitten loads, they always still feel hot, very itchy. So am I allergic to mosquito bites or just unlucky? Probably the answer is both. So you can get some local allergic reactions to the saliva from mosquitoes. So if you're one of these people that gets lots of really hot, itchy bites, then yes, you probably are having some slight local inflammation to those bites. And are you unlucky? Yes. Your genetics, I'm afraid, have made you more susceptible to reacting to these sorts of bites. And so, yes, it is bad luck, as well as your composition, your sweat making you more attracted to this mosquito. So I'm not sure that's helped you knowing it, but if it has, then hopefully it's helped you. What's the best way to prevent? Bed nets, if you want to go that far. If you're in a country where mosquitoes do spread diseases, then bed nets. And you can now get bed nets impregnated with insecticide to prevent things like mosquitoes biting you. So really important if you are living in or traveling to a country where you can catch some of these diseases. But things like repellent like Deets, picaridin, IR35, still can never get that name right. They really need to work on that name. And oil of lemon eucalyptus is the best repellents to try and stop them from biting you. Current user Clicker and Urax anti-itch cream. If the Urax works, the Urax is a brand of cream that you can buy from the pharmacy. If that works for you and it works and helps the itchiness, then fantastic. Everyone will be individual, and so different creams will work for different people. Urax is great, topical steroids is great, aloe vera gel works for some people, calamine lotion works for other people. So if it works for you, fantastic. The one that most people seem to benefit from, if it's a really nasty, swollen, itchy bite, is a small dose of topical steroid cream that you can get from your local pharmacy. So that's probably the best one to use. Hello, hi. If there's scar tissue that remains years after a bite, that sometimes seems to erupt in small bumps like a rash, and is still quite red looking, does blanch and press and gets itchy sometimes, do I need to see a professional? I've tried to use creams, but nothing seems to get rid of it. Nurse practitioner at the GP has seen it, and I requested to be tested for Lyme disease, and this came back negative. Good. Is there anything you can recommend? So, a bit like local inflammation, some people will react to lots of different bites, stings, injuries. When some people fall over, they have a more severe reaction than other people who fall over and graze their skin. And so, if you're one of these people, you might develop, for want of a better word, scar tissue or reactive scar tissue where that bite site was. Now, for most people, that scar tissue will either resolve completely by itself, can take some time, but can resolve by itself. And for others, are left with small bits of scar tissue, it feels like a small bump. Now, if that erupts every so often and you're getting ongoing reactions, then you've done absolutely the right thing to go and see people and ask about it. I always say if you're worried about something, that's what we're here for as medical professionals, is to try and help you. So I would say if it's worrying you, if it's bothering you, then you're doing exactly the right thing. Make sure that you see your GP and see if there's anything to be concerned about. Most of these scar tissue, these bumps that are left behind after a bite, are nothing serious and nothing to worry about. Often it's just scar tissue, and that's your body reacting to the bite when it happened. But obviously if you're worried about it, then we should be worried and worried enough to help and figure out what's going on. It will probably be nothing to worry about, and we'll be able to reassure. But if you're worried, that's enough. Make sure you go and see your GP and have a chat about it and see if they need to investigate for any different problems at that point. All right. Are certain people more prone to severe reaction from bites and stings? And we sort of answered this one already, but yes. So some people react much more seriously to bites and stings than others. So people listening or watching this who have allergies to bees and wasp sting will know that they have very serious reactions, whereas other people much more mild. Can bed bugs be transferred by skin-to-skin contact on, say, public transport? So this question, I think, is related to the bed bug apocalypse that happened last year that everyone should have been aware of in the news. First thing to say is the apocalypse is quite a slow one. It's been happening for over 2,000 years. So it's an ongoing apocalypse. How do you know this? I'm not 2,000 years old, as much as you might see from the video, but we have found evidence of bed bugs in Egyptian sarcophagi. So it's a very slow apocalypse, long time. Can they be transferred by skin-to-skin contact on public transport? I think that's highly unlikely. And for those of you that saw the viral videos going around of people taking videos of what they proclaimed to be bed bugs, they were actually common beetles that were walking up people's legs. So don't necessarily believe, and I completely get the irony of someone like me being on a video talking to you, but don't always believe what someone on a video is saying to you. Always have a look and see what you think is going on. Most people who get bed bugs often it's because they've been in a location or an accommodation where the bed bugs have been living. So if you've travelled and you've stayed in an Airbnb or a hostel, for example, where the bed bugs are, then that's how they've got into your luggage and you've brought them back with you that way. So that's much more common than, say, contracting them from someone next to you. I mean, bed bugs, if you think of them, and think of this with any insect, bed bugs don't fly, they don't have wings, so it's very hard for them to, and they don't jump either, so it's very hard for them to jump from one person to the next, fly, because they can't do that. And so actually be very, very difficult from getting on public transport. So public transport, fine for bed bugs. I'm not paid by TfL, by the way. So, right. I've never had problems with mosquito bites before, but the last couple of years I seem to have quite a bit of reactions, like quite big swelling on the bite area. Have I grown some allergy with mosquito bites? Can someone develop allergy in life? What are the cause of it? You're completely right. Yes, you can. You can develop local reactions to bites that you never did before, but it's also based on the different species. So obviously it's quite hard for me to have a conversation with you now, but if it was a different species or a different strain of mosquito that you've bitten you now, you might have always had a reaction to this, but you've never been bitten by that particular species of mosquito before and therefore developed a reaction. But also, even if it's the same mosquito, some people can develop reactions later on in life. Each of us individually will develop different sensitivities, different local reactions to different things as we age, and our immune systems change as we age. And so we do know that people can develop reactions to things that they weren't allergic to before. This isn't just with insects, this can happen with lots of different things, lots of different chemicals, etc., etc. But mosquito saliva is one of those ones that you could have now developed an allergy to. So first thing to say, I'm sorry that's happened, that sucks, but yes is the answer to your question. The best way to prevent some of the symptoms from it, as I said, is over-the-counter painkillers and the topical treatments that we mentioned about. So I'm sorry that's happened, rubbish. As someone who has it happen to them, I know how it feels. Right, let's get to some of the next questions. Oh, I've gone to the top, so let's see if I can get back down to the bottom of it, and we'll try and go through. Loads of questions, guys. Thank you very much for posting them all. Scar tissue, we've answered that one. I've never had problems with mosquito bites before. That's the one we got to. Right. Why can mosquitoes transmit malaria but not HIV? Fantastic question. So whenever we investigate what we call vectors of disease, so animals that can transmit infections to us after biting us, mosquitoes being the common one, we look at the diseases that can be spread. Now, it's not enough for an animal to be able to take up an infection. So let's talk about malaria and HIV, for example. If a mosquito were to bite someone who has contracted HIV, they'll be taking the blood up into the mosquito. So that's the first step. Can the animal take up a tissue, blood, a product from a person into them that contains the infection? So first step, yes. Sometimes when insects bite people, they can't take up that infection from a person. So it actually doesn't matter if the person has that infection or not. If the animal can't take it up from them, then the transmission cycle stops there. But we know, looking at certain insects, that they can take up the infection from biting people. So if they can, then that's step number one. Step number two. The mosquito, stay with the mosquito theme. They've taken up the blood meal. The blood meal's contained a virus, for example. Can the virus survive within the animal? So can the virus survive within that mosquito? If it can't, if the virus or the bacteria infection or whatever dies within the mosquito, the transmission cycle stops there. So can it take it up in the first place? Yes or no? If it can take it up, does it survive within the animal? Yes or no? If either of them are no, transmission cycle stops. Finally, if the answer was yes, it can take it up, and yes, it survives in the animal, third one is when it bites someone else, can it transmit that infection to the next person? Can it be transmitted in the saliva or the products from the animal that are put into the next person? And for some diseases like HIV, that does not happen in people. So we do not see that transmission that way. Whereas with malaria can be taken up. It does survive in the mosquito, And when the mosquito bites someone else, it can be transmitted. So it fulfills all three of those steps. So we test lots of different infections for those three steps. And luckily for us, lots of very serious ones can't be transmitted that way. So hopefully that makes sense. Great. Is the quinine in tonic still a repellent? Gin being a bonus. Thanks. Thank you very much, Debbie, for asking the question. Is it a repellent? Well, I did mention at the start, I don't know if you were here at the start, about alcohol. There is some evidence that alcohol attracts mosquitoes and attracts insects. So the quinine might be a repellent, or there's not that much evidence for it being a repellent, versus the alcohol actually attracting. So would I use it as a repellent? I'm going to have to say no, I'm afraid. But if you use another repellent, you can drink your gin on your holiday as well anyway, so you're all good. How do you know if a bite or sting is from a poisonous or venomous creature? When do I need to go to hospital? I guess the answer is you probably don't, unless you one of these people that like knowing about lots of different animals or creatures. Often places that if you're living in or visiting, the local people, or if you're one of those local people, will know the sorts of flora and fauna that are in the area. And so actually, local advice is often really good at telling you what sort of animals or plants or creatures are around that might be poisonous. And obviously we all have the internet these days, and so being very careful, and obviously you're watching me on this, so you can look up to see what sort of animals or plants in those areas can affect people. So it can be really, really tricky to know. Lots of the companies have now developed very clever picture software. I'm sure some of you use some of it. I've used it before. And actually taking a picture and using that picture to find out what it is from the picture can be really useful because it can identify what it is. Now, please don't go search. If you've been bitten or stung by something you think it's venomous, please don't go running after whatever bit or stung you, because you might then get bitten or stung again. But lots of resources for that. When do you need to go to hospital? If you're feeling very unwell, you're developing serious symptoms, so your heart's racing, you feel like you're dizzy, you feel like you're going to collapse, your skin starts swelling up, you can't breathe, any of these sorts of very significant symptoms, just a lot of bleeding, or anything that you're really worried about, that's when I'd start speaking or wanting to speak to a healthcare professional or going to a hospital, all right? So any of those sorts of symptoms where you start feeling really sick and unwell, definitely go and see someone at that point, all right? If I get bitten or stung on holiday, do I have to go to the hospital there abroad, or can I wait to come to the service? For the vast majority of bites and stings that happen whilst people are abroad, so things like mosquitoes, then no, you do not need to go and see a hospital. Most people, the symptoms, if they get any at all, will resolve by themselves. And even if they do get pain, itchiness, swelling, that will also resolve with over-the-counter medication. So no, for the vast majority of people. But obviously, if you're bitten or stung by something highly venomous and you start feeling very unwell afterwards, then please do go and see your local hospital. Or if you develop an infection whilst you're abroad, redness, heat, spreading redness up your arm, your leg, body, etc., and you start feeling unwell, then please do go and see a healthcare professional in that country, all right? So it all really depends what reactions happen afterwards. I got bitten on the foot by a spider in Indonesia 25 years ago, and that area still gets red and itchy sometimes. Is it just psychosomatic? Really interesting question, because I've had a few patients in my clinic now who've had the same thing. Some people have developed a new sensitivity to an area where they've had an injury before. And we do see this with other types of injuries. So some people that have had big traumatic injuries like car crashes or falls or sports injuries or whatever, the place where they were injured can be sensitive or sensitized to other things in the future. So I suspect for some people that area that was injured, maybe there's some scar tissue there, may be more sensitive than other bits of the body to certain exposures. So is it just psychosomatic? I think if it's actually getting red and itchy, then I suspect it might just be more sensitive than it was before the bite happened. But we are looking into that. We do have a few patients now that have the same thing. So no, I don't think it's all just in your head. What are more prevalent in the UK, mosquitoes or gnats? Are the risks the same, similar? We have lots of different fly species in the UK, actually, and obviously lots of people think about mosquitoes as being a kind of hot country thing. Lots of people don't know, but the UK did actually used to have malaria. So we do have mosquitoes in the UK, and we do have lots of different fly species in the UK. So there's lots of them is probably the answer to that question. Are the risks the same, similar? For most people bitten in the UK, bites are more of a nuisance from these species than anything serious. And luckily for us, most infections spread by these species are in warmer countries. But watch this space. Obviously, countries are getting warmer, and the UK on average is getting warmer, and that affects the ranges of certain animals, much like mosquitoes. And so the mosquito ranges are changing. So we might find in the future that certain species of mosquitoes that spread conditions like dengue, for example, we've seen lots of dengue in places like Italy and France. If the UK continues to get warmer, we might find those mosquitoes become more prevalent in the UK. So watch this space, but at the moment the risks are fairly minimal for people in the UK. Other than the obvious, are there far more sensitive parts of the body to be stung or bitten? That completely depends on you. So some people get, not me, but some lucky souls get bitten or stung by things and nothing happens. So we know with bed bugs that lots of people bitten by bed bugs, absolutely nothing happens to them whatsoever. They would never even know they've ever been bitten. So for some people, some lucky people, nothing happens. For you, yourself, some bits of you will be more sensitive than others. So some people find that if they're bitten under the arms, inner thighs, elbows, on the neck, face, that can be very, very sensitive. But it's completely individual to you. Are invasive insects or animals with more dangerous bite stings likely to be more present in the UK in the future? I don't know if they're more likely to. We do know that species can come across from other countries. So the one I like to give an example of is the UK's scorpion, which you can find in the Isle of Sheppey in Kent. And that was brought across, we think, by Italian merchant traders on their timber ships into the port. And it turns out they really like living in the UK, but they live in that very small pocket of the UK and don't move anywhere else. So we have a scorpion species that's invasive. Could a more dangerous invasive animal enjoy or do really well living in the UK? It's possible, and there are organisations monitoring for this to look out for more invasive species. There's been a lot of work done on caterpillars, so those of you in the summer have seen lots of processions of very hairy caterpillars. Oak processionary moth caterpillar is the big one that we look out for. It's got very irritating hairs. So we need to look out for these sorts of species and to see if they're spreading more or if they don't really like living in the UK and don't do anything. So really good question, and yeah, it's definitely a possibility that we keep an eye out for. I'm travelling to Indonesia in 2 months' time. I use Jungle when I go. So Jungle is a certain brand of repellent. My skin is sometimes sensitive due to dry skin and sometimes cuts on my hand. Is Jungle as good as Deets? What would you recommend when I need anti-malaria tablets? So to answer about anti-malaria prophylaxis, really good website, the gov.uk malaria prophylaxis website has a whole list of country risk. And so depending on the country or even the area within the country, it's a traffic light system. So it's red for high risk, orange, yellow, or nothing. Have a quick look, put in your country name on that list, and it'll show you a map of the country you're going to, and it'll tell you exactly whether you need anti-malarials or not. So that's the first thing to say. Jungle is just the brand, and Jungle do DEET repellent. They also do repellent with some of the other ingredients I was talking about, like picaridin. So just check on the bottle to see what ingredient it is. DEET has the most evidence, but if you have sensitive or dry skin, you might react to DEET, and so it might be worth trying the picaridin instead, although the most evidence is with the DEET. So if you can find a product with DEET in that works for you, doesn't cause side effects, that's the best one. All right, so try and use that one. Do those little electric shock type clickers effective in easing irritation on bites? Lots of people ask about the clickers. I say if it works for you, then great. Some people find they do absolutely nothing. So if it works for you, great. If it doesn't, it doesn't. So I hope that answers the question. Does what you eat or your diet have any effect on whether you're more appetizing for insects to bite? Lots of garlic, for example. So people thought lots of garlic. I wonder if it's something to do with vampires. I think the garlic thing's a vampire thing. Hopefully none of you are being bitten by vampires out there on your holidays. Does garlic have lots of evidence for preventing insect bites? It probably does change some of your chemical composition of your sweat, but would it change it enough to stop a mosquito being attracted to you if they are attracted to you in the first place? I don't think so. So probably the answer is no. It probably does not have enough evidence to say it prevents you being bitten. I'm afraid. So vampires, yes. Insects, no. How do you properly clean and disinfect a bite or sting wound? Can I just use soap, or do I need to use things such as rubbing alcohol? Do I leave it exposed or cover with plasters? So first thing to say is just simple things, so water, just to make sure it's clean, but soap and water, perfect. And for most of the time, that's enough, especially if the bite or sting is quite small. Now, if it's a big wound, then lots of, again, pharmacies, local family doctors, etc., some supermarkets even will have disinfectant sprays, really useful for using on kind of slightly bigger wounds, bigger cuts, so really useful for those sorts of things. Rubbing alcohol, I mean, alcohol can disinfect places. The problem is it hurts like hell when if anyone's put alcohol on a big open wound, stings like hell. So there are other products that will work just as well, that are just as easy to get hold of. Do I leave it exposed or cover it with plasters? I say if it's a big wound, you want to stop the wound being contaminated with dust, dirt, mud, etc. So a plaster can help for that. If it's a small one and your body's dealing with it, then you can leave it exposed at that point. Right, last question, I'm afraid. So I think the two questions from Emma, I'll answer them as one, just for the extra one. So my apologies for joining late. Don't need to apologise at all. May have covered this, or maybe inappropriate here. Is there please a way of easily distinguishing bed bug bites from dust mite bites or eczema or similar? Thank you very much. And same, sorry, are there any particular considerations for the very elderly, please? So in answer to that question, it's very particular and people's immune systems change with age. So very elderly might react to bites differently than they did when they were younger, and also to younger members of the family. So it's very, very individual and really hard to generalize as a whole. But in some individuals, as they get older, will react more to different bites or stings. Is there an easy way of distinguishing bed bug bites from dust mite bites or eczema or similar? So bed bug bites, if you're one of the unlucky people to even react to them, so lots of people never react to bed bug bites, so the distinguishing feature is you never know it even happened in the first place. But if you are one of those people that react, bed bugs can do something that we sometimes call breakfast, lunch and dinner biting. That's where they bite you in a row of 3. So you see these little clusters of 3 or 4 bites in a row, just in small bits of the body, and that can often be a little clue. Now, bedbugs are not the only animals that do this, so fleas can also do this, and certain species of lice can, so it's not a hard and fast way, but if you see tiny little clumps in little rows of 3, you see lots of little rows of 3 all over the body, then that might well be bedbugs, and dust mites don't really do that. Eczema tends to present a much more kind of flaky, itchy skin rather than individual bites. Bed bugs bite at night, and it can sometimes take up to 7 days after being bitten by a bed bug to notice the bite. So obviously checking where you sleep, around the mattress, around the bed frames, that sort of stuff, for any evidence of the bed bugs is sometimes the only way of telling that you've even had them in the first place. So checking for kind of feces or even the bed bugs themselves around the mattress frames, all around where you sleep is sometimes the only way to tell that they've been there in the first place. So I think that's all we've got time for, unfortunately. We do have some more questions, and I'd love to keep going and answer you, but we've all got time for. Maybe we'll be able to do some in the future, talk a bit more about bites and stings. But thank you very much to everyone who came along and asked the questions. Please do keep posting your questions, or we'll try and get round to them, and maybe if we do a future one as well, if people want to, then we'll do that. Please go and visit the UCLH site and give all the team members some great feedback. There'll be a survey running through afterwards. The usual, give us good likes, and you can always get your notifications if you come along to the hospital and see lots of the videos that will be coming up from the hospital about lots of different conditions. So if this is something that you're interested in, do let us know, and the team here will keep posting lots of good content for all of you. All right, so thank you very much for coming along. Hope it was useful, and we'll see you all again very soon. All right, so cheers. Bye now.